Talk about some promising new research in the fight against Alzheimer's, blood tests that could hold the promise to reveal earlier diagnoses, make those diagnoses more available, widespread for doctors, maybe even help patients seek earlier treatment, giving a predictor potentially of who's at risk for developing Alzheimer's. Research presented last week at the Alzheimer's Association International Conference in London. So let's bring in our guest, Dr. Ronald Peterson of the Mayo Clinic, a neurologist, the former director of the Mayo Clinic Alzheimer's Research Center, leads the Mayo Clinic study in aging. Doctor, thank you for taking time today.
My pleasure. Thanks for having me, Rob.
Yeah, this is a disease that is so impactful to so many, not only those who are fighting it, but their family members. I mean, the widespread impacts here can be very, very devastating. And the research involved in the diagnosis and treatment certainly has just utmost importance. Tell us about this particular research. Two different studies presented last week that involve the use of blood tests.
Exactly. I mean, formerly we'd have to do either a PET scan to look for the two proteins that cause Alzheimer's disease, amyloid and tau, in the brain. We either do a PET scan or we could do a lumbar puncture, spinal tap, to detect the proteins in the cerebrospinal fluid. Those are pretty accurate, but PET scans are expensive, lumbar puncture is invasive. So a blood test opens up the new avenues for us to making the diagnosis much more quickly, much more reliably, and more widespread across people in all parts of the country. So this was exciting. At the same time, we can't jump to conclusions right away that a blood test will definitively diagnose Alzheimer's disease. We're doing some work down here in Rochester at the Mayo Clinic on the use of these blood tests in the general community and generally getting very positive results.
Now, these blood tests, as I understand it, they still are trying to detect the same two proteins that would be otherwise detected in the traditional diagnosis methods, right?
That's exactly right. So when we talk about Alzheimer's disease, we talk about the clinical picture of how a person might be more forgetful than he or she used to be, having some trouble with daily function. And then we ask the question, what's causing that clinical picture? And here's where Alzheimer's disease comes in as a very common, but not the only cause of cognitive impairment. But we need to detect the presence of those two proteins to nail down the diagnosis of Alzheimer's disease.
All right. One of the studies presented last week looked at how with these blood tests, if primary doctors had access to these blood test results, the accuracy and diagnosis significantly improved. And I think you were quoted in an article I read saying that, you know, not every doctor has access to this PET scan technology.
Right.
So tell us how that particular study, access to these blood test results for doctors, improving diagnosis.
Sure. So I think that's reality. I mean, I'm a clinician. I make this clinical diagnosis, but I don't always know if the clinical picture is due to Alzheimer's disease. That's where the blood tests come in. So in this study, they said, doctor, what's the likelihood this is Alzheimer's disease? The doctor said thumbs up, thumbs down. Then they did the blood test and improved the diagnostic accuracy of the clinician. So that's enhanced our ability to determine whether people might be eligible for now these drugs that are available to treat Alzheimer's disease.
What are the concerns about the accuracy of this test? I saw one statistics saying 90% accuracy, but that doesn't mean you don't get false positives. I think you had mentioned that the PET scan may indicate it, but the blood test doesn't, or vice versa. So what are the concerns about this right now?
Right. You've raised some relevant issues, Rob, that sometimes the blood test can kind of overcall the disease. So a false positive means that you get a positive blood test, but in fact, you do not have the amyloid protein in the brain. We try to keep that as limited as possible, but it is real. So in our Mayo Clinic study of aging down here in Rochester, Olmsted County, we found inconsistencies in both directions. Positive blood test, negative PET scan. positive PET scan, negative blood test. Consequently, before we make the decision to treat somebody with these disease-modifying therapies, we will validate the blood test with a PET scan or a lumbar puncture. That's our current state. But I think the field's evolving toward the accuracy improving with these blood tests.
So how much earlier then could diagnoses be possible?
Oh, quite early, quite early. In fact, I mean, there are now situations where we can do a blood test in somebody who's clinically normal, but if they have a positive blood test, means they may have the underlying predisposition to the biology of Alzheimer's disease. There are 2 clinical trials, drug trials underway right now for people who are clinically normal but have positive blood tests to see if, in fact, we can delay the onset or postpone the symptoms over time. And I think the readout from these 2 trials will come out in the next year or 2 or 3. That'll be a big deal because now we're talking about people who are clinically normal, but we may be able to intervene early and hopefully prevent the disease.
Yeah, and I believe that was the second study presented at the International Conference last week and then published in JAMA. About how this can maybe predict the disposition for this 5-10 years out.
Yes. In fact, also in that same session, my colleague, Dr. Cliff Jack and Dr. Alicia Algeciras here from Mayo presented data on our risk prediction formula, where we can now, again, based on the Mayo Clinic study of aging, we can plug in your age, your sex, whether you have a genetic predisposition with this apolipoprotein E, and then plug in a biomarker like a blood test and give you a prediction as to what is the likelihood that you will develop cognitive impairment in the next 2 years, 5, 10, or in your lifetime. And that's incredibly important because now if drugs become available in that situation, cognitively normal, positive blood test, do I want to take this drug? Might have some convenience issues, might have some risk factors, might have some expense. I need to know what my risk of developing cognitive impairment without treatment would be compared to what it would be with treatment. And that's what the data that we've produced now will help the decision-making process.
So what's the availability of these blood tests then? Are these still purely in clinical trial forms, or are they available beyond that?
Well, it's a touchy issue. They are available, and actually there are some direct-to-consumer, which we're not wild about right now. We think these need to be used in a clinical setting. I think your doctor needs to really order these given your clinical situation rather than a home test, but they are clinically available.
They are clinically available, but so right. The research is just showing, basically backing up that they can be very effective.
Yeah, absolutely. The research now is validating what a positive blood test means.
Okay. Well, where does this go then in the next several years in terms of better diagnoses, but also, I mean, does this help inform any of the research into better treatments?
I think these blood tests can be used in one of 3 forms. One is predicting who might be amyloid positive, have the biologic features of Alzheimer's disease now. Secondly, what about the diagnosis? Can we make the biologic diagnosis of Alzheimer's disease with a blood test? And most exciting, can we use these blood tests to follow therapies? Since there are drugs now that are available that lower the amount of the amyloid protein in the brain, might we be able to follow the effectiveness of those therapies by following a blood test, like we do with cholesterol? We have elevated cholesterol. We take a medication to lower that, and we measure our cholesterol later on. We're going to be able to do that, I think, with these blood tests for Alzheimer's disease.
Is this something, too, where somebody needs to get more than one blood test in this process for diagnoses?
Well, one should be good, depending on the accuracy, as we discussed earlier, but you'll need serial ones to see if, in fact, it's going up or going down, especially with treatment.
Okay. And then finally, before I let you go, for those who are, again, looking out here over the next set of years, how would you describe, how rapidly we're evolving in terms of developing new treatments? Is this something that is kind of stubbornly slow, or is this something that promises maybe some more rapid advances?
It certainly had been slow for many years, decades actually, but in the last few years now we've had 2 drugs approved by the Food and Drug Administration for the treatment of Alzheimer's disease. Others are under investigation right now that may do a little better job. And then ultimately, where we're headed down the road is combination therapy. So maybe a drug that's going to lower the amount of amyloid in the brain, and another drug that'll lower the amount of tau in the brain, the other protein in Alzheimer's disease. So I think we're headed in a positive direction for really slowing down this disease and maybe even preventing it.
Well, that's good news, because for many, many years, people weren't getting good news on the progress of treatment for this. It's been a very, very frustrating thing for, I know, for folks like you in this field. So thanks for taking the time to explain this. And let's hope that this continues to yield some very promising diagnoses and treatment.